Ladies and gentlemen, World Hypertension Month alerts all medical practitioners to the importance of proper diagnosis and effective treatment. In our commitment to public health and professional service, IPCA proudly presents a daily take-home message throughout this month. These insights are provided by the eminent Padmashri Dr. C. Venkata S. Ram, a global legend recognized for his pioneering contributions to our understanding of hypertension. Listen to Dr. C. Venkata S. Ram's today's message.
Greetings to my fellow medical practitioners all over the country. In connection with the World Hypertension Month of May, the message for today is about the role of angiotensin receptor blockers in the treatment of hypertension. In the last few days, I covered the general treatment of hypertension, general drugs for the hypertension. I covered diuretics. I covered beta blockers in the treatment of hypertension. I covered ACE inhibitors for the treatment of hypertension. Today, we will cover the role of angiotensin receptor blockers in the treatment of hypertension. Angiotensin receptor blockers are very effective drugs for the treatment of hypertension. A number of clinical trials have shown the cardiovascular and kidney benefits of angiotensin receptor blockers. Angiotensin receptor blockers have a specific advantage in patients who have chronic kidney disease, in patients who have diabetes, in patients who have proteinuria. No doubt they are quite useful in patients with uncomplicated hypertension, but particularly in patients who have compelling indications, angiotensin receptor blocking drugs can be used. Angiotensin receptor blocking drugs can be used either as monotherapy or in combination with other antihypertensive drugs. One should not combine ARBs with angiotensin converting enzyme inhibitors for the treatment of hypertension because there is no evidence that combination of ARBs with ACE inhibitors together will be useful in patients with uncomplicated hypertension. But angiotensin receptor blocking drugs by themselves are very good drugs for the treatment of hypertension. One should again try to choose a long-acting angiotensin receptor blocking drug such as telmisartan for the treatment of hypertension. Studies with telmisartan have shown so many positive outcomes. So it's a very popular ARB for the treatment of hypertension. So ARBs like ACE inhibitors are quite safe for the treatment of hypertension. But in patients who have chronic kidney disease, keep an eye on serum potassium and creatinine levels once in a while in patients with chronic kidney disease so that you are not causing hyperkalemia or worsening of renal function. But overall, among RAS blockers, angiotensin receptor blocking drugs become an integral part in the treatment of hypertension, very useful drugs. And I told you how to select these drugs earlier on.